Hello, my name is Erica Konjerski, and along with Christina Irish, we are students at Concordia University studying for our master's degree in nursing practice. Christina has been a registered nurse for approximately 10 years and is currently with Mercy Health. Since the start of her career, she's seen the need for increased rules on the prescriptions of controlled substances and the need for opioid abuse treatment. This topic is also very near and dear to her, as she has a close family member who was in need of treatment at one time. I have been a nurse for about 3.5 years, and working in the emergency department, I have seen the devastating effects of opioid abuse both at work and in my personal life. I have 2 friends from high school that have passed away from heroin overdoses and have witnessed the detrimental effects to both the physical and emotional health of families and patients. We both believe that helping family patients with opioid addiction should be a top priority for policymakers. Our shared goal is to become nurse practitioners in the field of family practice so we're able to educate patients on the importance of preventative care, young and old. So we are going to be discussing the Health Policy Brief Assembly Bill 701 in Wisconsin. Assembly Bill 701 was developed to create a regional pilot program to address opioid addiction in underserved areas for the state of Wisconsin. The treatment programs will assess individuals to determine treatment needs, provide counseling, and medical or abstinence-based treatment. After individuals successfully complete the program, they will be transitioned into a county-based or private post-treatment care. The bill was introduced by Representative Nygren along with 27 other representatives, as well as co-sponsored by 6 senators. It was published on April 8, 2014, and had an audience including the Joint Committee on Finance, the Committee on Health and Human Services, and the Committee on Senate Organization. The Wisconsin legislation currently has a related bill in progress. Wisconsin Assembly Bill 8 has been developed to create additional opioid treatment programs for all Wisconsin areas. We are currently facing an opioid epidemic in the United States. According to the Wisconsin Department of Health Services, the misuse and abuse of opioids is a public health crisis in Wisconsin and is a priority of Governor Scott Walker. During 2015, the CDC estimated 47.7 million persons in the United States aged 12 or older used illicit drugs or misused prescription drugs. From January to March that same year, there were 1.17 million opioid prescriptions dispensed in the state of Wisconsin alone. In 2014, it was noted that there was a 28% increase in opioid-related deaths since 2006. Many citizens are affected by the opioid epidemic, including healthcare workers. According to the CDC, an estimated 53,000 hospitalizations for non-fatal unintentional drug poisonings related to opioids occurred in the United States in 2014. There were also 92,262 emergency department visits in the U.S. related to unintentional opioid poisoning. Not only are healthcare workers affected, citizens of our communities are affected. According to the Wisconsin Department of Health and Human Services, from 2012 to 2014, the number of community-based individuals trained to administer naloxone in Wisconsin increased by 123%, as well as peer-reported overdoses saves also increased in this time period by 70%. According to the NIH, the average cost for 1 full year of methadone maintenance treatment, including medication and integrated psychosocial and medical support services, is approximately $6,552 per patient. To put things into perspective, the amount paid for treatment of substance abuse disorders is only a small portion of the costs these disorders impose on society. A recent analysis suggested that the total cost of prescription opioid use disorders and overdoses in the United States was $78 billion in 2013. Of that, only 3.6%, or about $2.8 billion, was for treatment. Research has shown medication-assisted treatment decreases opioid use, opioid-related deaths, criminal activity, and increases social functioning and retention in treatment. The Substance Abuse and Mental Health Services Administration, or SAMHSA, established accreditation requirements in federal regulations in 2001 to help opioid treatment programs improve the quality of patient care, treatment services delivered in the opioid treatment setting. The intent of this bill is mainly to open up opportunities for people in Wisconsin living in geographical areas that don't have access to opioid treatment. By doing this, there's a chain reaction effect that helps our communities in other ways. With less opioid-addicted people, there will be less opioid-addicted babies. There is less potential for less crime. There is the potential for less crime, meaning less court costs and prison costs. This bill improves the quality of lives for our neighbors and friends. This bill helps reduce unnecessary death in Wisconsin. As caregivers, we do our best daily to try to save lives, and this is how our legislators are trying to do the same thing. This budget would affect counties individually and does not come from the state budget. Some patients will require inpatient residential care, followed by outpatient counseling and medication-assisted treatment, with a total cost of $480,000, while the majority would require outpatient services only, totaling $1,536,000. This includes medication-assisted treatment and counseling. The total yearly cost was estimated at $2,016,000, although this does not take any insurance coverage into effect. If patients have insurance to contribute, the amount of patients that could be treated will increase. John Nygren is a Republican state representative. He is one of the main stakeholders for this bill and is also co-chair for Governor Scott Walker's task force on opioids. Nygren, along with Rebecca Kleefisch, work alongside the governor to combat the opioid crisis in Wisconsin. Nygren is clearly passionate about fighting the epidemic, as he helped to pass 16 other bills regarding opioids. Some of the bills addressed stricter guidelines for prescribing opioids, enforcing laws for possession and distribution of opioids illegally, increasing access to Narcan, and participating in a national database for opioid prescriptions. Additionally, Nygren helped to allocate $5.38 million in new funding for residential substance abuse services through Medicaid. So for our recommendations, after researching the topic, our team of bachelorette-prepared graduate nursing students support the passing of Assembly Bill 701 for the creation of opioid treatment programs in underserved areas. With the opioid epidemic in our midst, the need for additional treatment programs is crucial. Although it is felt that preventative measures are a major source of solution, the fact of the matter is we need to manage this devastating crisis. Research has also shown that much more funding is utilized for prescription opioid use disorders and overdoses, and that treatment is a minor 3.6% of these costs. It has been proven that medication-assisted treatment decreases opioid use, opioid-related overdose deaths, criminal activity, and increases social functioning and retention in treatment. Although retention has been proven, we feel it is necessary to evaluate the programs to ensure they are appropriate in managing the patient's needs. With that being said, our society is in great need and we need to help. Here are our references for this presentation. And I thank you for listening, and this was Erica Kondersky speaking, and Christina Irish that also was contributing. Thank you.